Good day, Edson community and Edson Medical Center patients. We decided to give you an update on the current COVID-19 pandemic and how it applies to us as a community, and specifically what our regulations at the Edson Medical Center will be from here onwards. We would like to encourage all our patients to visit the Alberta Health website, where they will find a self-assessment tool, and they could follow the instructions on this tool to see if they are eligible or required to do a self-isolation, or if they need swabs or testing done. We also encourage all patients that think that they meet these requirements or that have symptoms of a cold or a flu to phone 811 and follow the instructions that you'll be given there. There is quite a wait time for these phone calls, but it's worth it to stay online and get advice from these designated officials and nurses that you will be speaking to.
Yeah, that said, if you think you have an acute medical emergency, you need to phone 911, and emergency departments are still open for those kinds of problems. We are just saying that if you have cold or flu-like symptoms that may or may not be related to the current viral outbreak, you are to phone 811 or visit the Alberta Health website for advice, because that is where we're getting our guidelines from currently.
Okay, let me talk about self-isolation. So self-isolation is in Alberta right now defined as if you are returning from overseas, you are to stay at home for 14 days to see if you develop symptoms that could be similar to COVID. If you have a cold or flu, you'll be directed to stay at home until you are well by 811. Or if you have been asked to stay at home by 811, or if you are staying at home because you have an unwell family member and have been instructed to do so by 811. These patients in Edson who are self-isolating, please call the Edson Medical Center if you need medical attention, and our doctors will do that consultation by phone. We have the ability to phone you at home and deal with the medical problems you might have, including prescriptions and test results.
We realize that many of you already have appointments this week that are pre-booked. If you're concerned about whether that appointment should continue, or if you in the interim develop any symptoms of a cold or a flu, we ask that you follow the advice we've given you today. Otherwise, if you're feeling well and you're not a high-risk patient, you may still come into the clinic. However, if you prefer to do that consult by phone, leave a message for your family physician and they will return your call on the day of your appointment.
I would like to talk about social distancing and what that means for Edson. So you'll hear today that school classes are closed. Social distancing is where we try not to gather together. If you are around other people, we try and keep 1 to 2 meters apart. We try and keep our hands clean and not touch our face. It's trying to avoid peak times and places where lots of people will gather to try and reduce the spread of illness.
All right, and just to give you an idea, I've been in the emergency department working today, and there have been a number of people just in the last few hours that have arrived and asked the clerk at the front, can I get a swab done for COVID? Just a reminder, this emergency departments are not designated areas to get COVID testing done, whether you're symptomatic or you have no symptoms. The advice is to please call 811 or use the self-assessment tool on the Alberta Health website. The same thing goes for the Edson Medical Center. That is not a designated test site. We are trying to keep this going all through public health by use of 811 and the Alberta Health website. Check it for updates. It's changing daily or multiple times per day. That's what we're doing. That's where we're getting our guidelines from. So yeah, please endeavor to do that, and we'll keep you updated as soon as we know anything else.
In closure, I would just like to say that as David mentioned, we are following the advice from Alberta government right now as it's posted widely for everybody to see. Dr. Dina Henshaw said that we should adjust because this is the new normal. That counts for every Albertan. What we know about this virus at the moment is that it is not going to go over very fast. This is not a winter storm. This is a long winter we're in for, and we're going to all have to adjust to these changes in order to slow down the spread of the virus. By doing that, we are reducing the load on our healthcare system and making sure that we can provide care to patients where they need it, when they need it, when appropriate. Thank you.